I am Reverend Linda Hannah Walling, and I serve as the Executive Director of Faithful Reform in Healthcare. And the office is in Cleveland, Ohio, at First Methodist Church in downtown Cleveland. But it is a national coalition of faith organizations and individuals working on healthcare reform in the United States and in their local states. It really began out of my work with another healthcare justice organization, the Universal Healthcare Action Network. I served for 7 years as their faith project director, and when they restructured in the fall of 2006, I was not willing to give up the work that I had been doing for these 7 years, and so in consultation with the folks with whom I had worked over this time, we agreed that an independent faith initiative for healthcare reform in our country would be appropriate. So we launched Faithful Reform in Healthcare. The hope in the short term is that the faith community can contribute to the cultural transformation that will be needed to create an environment in which compassionate and comprehensive healthcare reform can be discussed. The long term, of course, is the vision of a country that includes everybody in its healthcare, that everybody should have the healthcare that they need. There are still a lot of faith communities that have not embraced working on healthcare reform as a priority. So I'm really hoping to expand it beyond what it is today. I think the first conversation has to be around our shared faith values, that for those who are in the Abrahamic faiths, the Christian, Jewish, and Muslim faith traditions, to say that God created us to live in community with one another and to care for one another and to reach out with compassion, with particular concern for those who are vulnerable, and to fulfill God's intentions for us, who we are meant to be as children of God is to live full and healthy lives so that we can become who we are meant to be. And millions of people in our country are compromised in fulfilling their potential because they can't get the health care that they need. That's a faith issue. This issue that has been debated in economic terms all these years, we can't afford it so we can't do it, needs to be talked about through the lens of a different frame, through moral values, about how we care about each other, who we are meant to be as a country. I started this because I was looking for a job. After 30 years in congregational ministry, I got to the point where I couldn't recruit any more Sunday school teachers or do any more bulletin boards. And in doing a short-term project with the National Council of Churches, I was introduced to a number of folks in the healthcare justice movement who were based here in Cleveland. So when I started this in 2000, it was a new job. It was a ministry. But since then, I really believe that I somehow have been called to this. Senator Sherrod Brown, of one of Ohio's new senators in recent years, spoke at a conference that I attended, and because he was speaking, the folks from Ohio got to sit right in the front. And he said, the two most important days of your life are the day you were born and the day you realize why you were born. And the tears flowed when I said, this is why I was born. This is what I'm supposed to be doing right now. The commitment to it, I guess, was reinforced this fall when my son was very, very ill. And by the time he was in surgery, he had a deep neck abscess that was pressing on an artery to his brain and had displaced his trachea, to the point that another 24 hours could have been a very life-threatening situation. And during the whole time moving up to that, We were in constant conversation with a pediatrician and a pediatric practice that knew us and whom we knew and whom we trusted. And when they said it's time to go to the hospital, I didn't have to worry about how we were going to pay for this because I had an insurance card. And as things proceeded, I realized that my son was the benefactor of some of the best health care in the United States. And he's recovered, he's healthy, he's well. But in the midst of that, I realized that there are mothers who would have been holding children that they couldn't get the health care they needed. And that's just not right in the richest country in the world for children not to be able to get the health care they need, or for that matter, for adults not to be able to get the health care they need. So that's why I'm doing it. It's just the right thing to do. One of the gifts that the faith community brings to this is the gift of hope. The faith community, throughout our thousands of years of history, has found itself in the desert experience a lot. And I think our country is experiencing a bit of a desert experience right now. And I think that the faith community has the opportunity to bring a message of hope and inspiration. And I think that can be found in the fact that we care about each other as people, and that what brings us together is our human relationships, not our economic well-being. And I think our country is beginning to realize that it is the story of human relationships, not individual wealth and affluence, that makes us great. The story out of the Native American tradition, where a child, where a grandfather is saying, there are two wolves within each of us. A good wolf that thrives on distrust and dishonesty and greed and all of the negative things in life. And the good wolf that thrives on hope and goodness and peace and sharing and compassion. And the grandson says, which wolf will live? And the grandfather said, the wolf that you feed. And I think the faith community has the potential and the responsibility to feed the good wolf that is within all of us. And if we do our job, then we can make healthcare for all a reality in our country. We are not going to make the changes that are needed in this country without every person in this country, including every person of faith, calling their elected officials. That means in their communities, in their state houses, and in Congress, to say that we expect our leaders to be true to a higher set of values. And they may all be different religious values, but all of our religious traditions share values of compassion and community and inclusion and taking care of one another, taking care of our resources, and making the world a better place.